Here's a must-watch video on why PCOS has been renamed to PMOS. This is something you don't want to miss, and every woman should hear this update because this impacts your whole body. What if I told you that the most common hormone disorder has a name update and has been all wrong? Millions of women have been suffering from misinformation about this type of condition. 1 in 8 women have PCOS, polycystic ovarian syndrome, but that's now called polyendocrine metabolic ovarian syndrome. What does that mean? It's not just about ovarian cysts and testosterone, androgen imbalance, and irregular periods, but so much more than that. There needs to be an update, and you need to know what that update is. For decades, women have been told that it's just all about their ovaries, that their ovaries are messed up, and that's why they can't get pregnant. That's why they have horrible acne and their periods are irregular, or maybe they're even missing their periods. I have news for you. It's much more complex than that. And finally, there's a Lancet article that has just been released here in 2026 of May. And there are many organizations worldwide where they ask providers, patients, providers from all types of specialties and different age groups of patients. And most patients were for this, and different specialties were also for this name change. And you know what? They have a lot of catching up to do because in integrative functional medicine, we are always ahead of a game. We know that all systems communicate together. And I'm Dr. Melissa, integrative lifestyle doctor, who focuses on this hormone connection to the entire body and to other hormones, gut, brain, and it's all connected. The term PCOS has fooled so many women, and the medical system had no idea that it had to do with not just androgen and ovarian cysts, but more than that. These ovaries are basically not just cysts, but they are arrested follicles, follicles that are not able to mature to the full. And that's why we look at anti-Müllerian hormone in PCOS, or now called polyendocrine metabolic ovarian syndrome, where AMH can be potentially high, androgens can be high, testosterone, but most importantly, insulin. However, most traditional doctors are not trained to test for fasting insulin. They solely only check for blood sugar, maybe fasting blood sugar, or an A1C. The treatment for PCOS has typically been lifestyle changes, weight loss, and metformin. However, we know people with polyendocrine metabolic ovarian syndrome have more issues than that. They may have acne, they may have hirsutism, which is excess hair in places that they don't want around their face, maybe on their chest, and on their legs and arms more than usual. And this is strange for most women and annoying. And the most alarming fact is that women in their teenage years start to have PCOS-like symptoms, but aren't diagnosed till much later in decades when they're struggling to get pregnant or when they've had multiple miscarriages. So we need to get ahead of game and realize that it starts in teenage development with hormone imbalance because of insulin resistance, because of high blood sugar in the body for long periods of time, and lack of exercise and lack of fiber and antioxidants, and high processed foods, high sugary foods. We need to look at something different. There's something dangerous about the title about PCOS. It's misleading, it's stigmatized, and finally, we in medicine are getting a little bit closer to the real definition of what's happening in the body. It's an endocrine imbalance. However, most physicians, primary care, OB-GYNs, even REI doctors are not checking all the potential labs. It's important not only to check fasting insulin, blood sugar, but even checking thyroid, checking if there's other inflammation, ESR, CRP, looking at thyroid from a bigger scale, TSH, T4, T3, TPO, that's your thyrodoxate peroxide antibody, looking at antibodies on the thyroid receptors. So we have to look deeper and figure out what is the imbalance of the hormones, of the estrogen and the progesterone. Is progesterone really low? Is estrogen really high? What kind of lifestyle changes can we do? What kind of supplements can we implement? The most common issue that women have with PMOS is not just the lack of periods or regular periods, but also mood issues, depression, anxiety, irritability, waking, difficulty losing weight. It can be horrible. Women try all the right things. They're exercising, they're dieting, and they're still not losing weight. And they may be even given anti-anxiety medications and feel extra depressed, told to go to therapy or take an antidepressant, but they're not having their hormones checked or having a good ultrasound to see what's going on in their period and what part of their cycle is actually deficient. Are they able to have a full follicle? How many follicles are they able to have? There's so many things that happen in one cycle that we need to address early on, not just in adult years, but in teenage years. Often women with PCOS, but now called PMOS, are having sugar cravings. They're looking for that sugar rush and they don't know why. The fact is it's not just a fertility issue, it's not just an ovary issue, and it can't always just be solved by giving birth control and hormones. But it really needs to address the root cause. We need to uncover those rocks and look at all the puzzle pieces and see what's really triggering all these symptoms, because it's not always straightforward. Oftentimes, PCOS is associated with many different conditions, and that's why it needed a name change. When we look at PCOS, women often had obesity, fatty liver disease, hypertension, high cholesterol, and even heart disease. What does that look like? It looks like metabolic dysfunction and hormone dysfunction. Hormones and metabolism are deeply connected. That's why women with PCOS or PMOD struggle not only with their weight, but their fatty liver. They're struggling to lose weight, and we need to stay on top of the game. All in all, PMOD is complex. There's hormone disruption, chronic inflammation, a whole cascade of hormones that may be irregular, the thyroid, the cortisol, the estrogen, progesterone, so much, DHEA, testosterone. It can be many things, and we need to check labs. It can be driven by inflammation or other diseases or by stress. So here are the things that you can do to get ahead of and to potentially reverse PMOS. Most traditional doctors will prescribe the birth control pills, either the combined estrogen progesterone types of birth control or progesterone only. However, other doctors will give metformin to slightly adjust the blood sugars and hope for weight loss. However, that does affect kidney and potentially liver. Or they'll give spironolactone for the acne, but that can serve as a strong diuretic where women are often peeing more than they want to, and it's causing them even more fatigue. So medicines in that regard may not be ideal. However, another aspect that we are looking at is, of course, GLPs and peptides, GIPs, to look at hormones to help down-regulate the insulin resistance that might be happening. But the first steps are lifestyle changes, introducing more plant-rich foods. That's fruits, vegetables, beans, nuts and seeds, things that are high in fiber, high in protein, and all these antioxidants to reduce those inflammation, to help stabilize the blood sugar and help improve insulin resistance. And definitely avoiding high sugary foods as well. If that's donuts, if that's chips, if pastas, rice, and ice creams, and not having that constantly every day, but having whole foods instead. Most women with PCOS have sleep apnea and insomnia, irregular sleep, so it's so important to address the why. Why are you having a hard time sleeping? Are you stressing out too much? Are you overthinking it? Are you not having enough progesterone? Or if you having too much sugar late night? We gotta know why your sleep is off. Chronic stress, that is the most common reason why people have PMOS. They may have normal hormones in terms of estrogen, progesterone, DHEA, and AMH, but their cortisol may be very high, and their periods may not be too irregular. It may look somewhat normal, but their stress is high and their ovaries are suffering because they are not maturing to a full follicle. So it's important to do things like meditation, taking your weekends off, going out into parks, doing some exercise. And exercise is queen. Moving, reducing your cortisol, helping the mitochondria produce that ATP and energy. That's going to be really helpful for healing. Exercise is important for the hormones to regulate. And you don't want to over-exercise either, because that can be extremely stressful for the body too. Making sure that your gut is healthy is a priority. If you're having bloating, constipation, reflux, that can be clues that your hormones are off. So make sure you get your hormones checked. If you're depressed, anxious, feeling like you can't focus, feeling fatigue, you also want to check your hormones and potentially your follicles as well. Now, we don't want to ignore pollution and environmental toxins. Toxins can be found in our food, in our air, and in our water. It's everywhere, and we want to be mindful what we can manage and read labels and get air filters and water filters. Now, there are common deficiencies associated with polyendocrine metabolic ovarian disorder. Vitamin D deficiencies, magnesium deficiencies, antioxidant deficiencies. It's important to get those labs checked by your doctor, and preferably an integrated functional doctor like myself, who understands the connection between micronutrients, antioxidants, and hormones. Most women may also lack omega-3, so make sure you're taking some omega-3 rich foods such as flax seeds, chia seeds, and some people like algae or fish, so make sure you're taking some omega-3. Why does PCOS or PMOS matter in the long term? It matters because not only do you need to treat and manage your PCOS or PMOS by lifestyle changes, supplements, or even medications, it's because there's an increased risk for heart disease, endometrial cancer, endometrial hyperplasia, and we don't want to ignore these risks that can happen in the next few decades or even sooner. The most common comorbidities with polymetabolic ovarian syndrome is going to be type 2 diabetes, obesity, heart disease, and even other issues with fatty liver, high cholesterol, and sleep apnea. Now, I don't know about you, but I'm so happy that PCOS has a name change and we can stop this misinformation and get a more accurate picture of what's going on in the body, because each system is deeply connected and we can't treat one system without ignoring the other. We need to take a deep dive on your labs, your nutrition, your lifestyle. And that's what I do in my clinic at Dr. Lifestyle. So if you want to hear more of all things lifestyle, integrated women's health, gut, brain, immune health, I'm your doc, and we'll see you next time. So like, subscribe. Thanks for joining, and we'll see you next time.